Welcome to our course, everyone. I'm Dr. Chuck Ruot. I'm privileged to be your professor here for this course, graduate course, KIN 562, Exercise and Fitness Education. I thought I would do a little video clip so you could see me in my office and know a little bit about myself and overview week one. I've been teaching for CBU for some time now, both undergraduate and graduate courses. I have a doctorate in kinesiology and health promotion with a strong background in exercise science. And this type of course is one that I've had the opportunity to teach throughout my career. This specific course, I did not design it, but I'm privileged to teach it. And so this is my first time to actually utilize this course. I think I've been through it. I've looked through it. It looks like it's well put together. There's a lot of good stuff in here. So I'm just going to say welcome to class. If you check the syllabus, you'll see my cell phone is there. Should you need to communicate other than through email, please feel free to do that. I'm here to assist you guys, facilitate you. I know that you're busy professionals who are also living life, working jobs, some of you raising families. You're in a variety of things. So I am here to help you. I want to simply mention some things here for the first week. As you can see on the screen here, as you know, all of our courses are put together in a fashion where you have a week 0 for some things that you can actually get familiar with, such as the syllabus, APA formatting, how to find research articles, feedback from the instructor, and the things that you need to complete are the introduction in the discussion board and the course pretest. So as you work yourself through this, please reach out to me if you have any questions. Week 1 now, you can see here, is on assessment. And we use 3 different books in the course, and they're listed on your syllabus. And we also have some material that's provided to you that's actually in PDF, because 3 books is probably enough to ask you to buy for one particular course. So in this first week, you'll see that you also have something from the American College of Sports Medicine's Exercise Testing and Prescription Guidelines book. You'll see the pages 19 through 59 are provided for you in a PDF. And you'll also see that's chapter 14 on warm-up and flexibility from the NSCA's Essentials of Strength Training and Conditioning. This is the same book that's used to prepare for the Certified Strength Conditioning Specialist. And so these 2 sources are used as your background information, your learning material for week 1, and for your quiz 1, which is adapted and taken from these sources. So now let's look specifically at week 1 here. And you'll see that the overarching theme is assessment. And so the objectives are to expose you to a battery of tests that you can use to assess the readiness and the physical capacities of someone beginning a workout or exercise prescription program. So a part of that is also assessing their or screening their readiness as far as cardiovascular risk and looking at the areas of strength, endurance, flexibility, mobility, and also looking at movement screen stuff. So as you look at the material, you'll see there's a lot of stuff here that you would be going through regarding any clients you're working with, regarding whatever training objectives that they have. In addition to reading the materials and watching the lecture video, there are basically 3 things that you need to complete for a grade. Obviously, quiz 1. There is the critical assignment preparation, or CAP 1 as we call it, that's entitled Health Assessment and Movement Analysis. Now, each week you'll have a CAP assignment, which is building towards the final critical assignment for the course. So it's building that way. And then also you have an exercise technique worksheet, which I think is, if I recall right, is comprised of 5 particular questions, and you have 3 attempts to actually do this one to keep bettering your score. Here you see the material that you're to read. Here's the PDF of the ASSM guidelines here, and here's an actual PowerPoint you'll find me doing a voiceover to, as well as a PowerPoint from the chapter 14, the essentials on warm-up and flexibility. So here's your quiz 1, which is comprised of 10 questions covering from the lecture voiceover and the reading material. And you can see there's a standard multiple choice, true, false, and short answer, fill in the blank kind of format. Then secondly, here's the CAP 1 assignment, which is the health assessment and movement analysis. And as you read through this, you'll find here are the materials posted that you need to actually be able to complete to turn in. So basically in this first week, you are identifying a subject who is 30 years of age or older that can actually be your subject throughout the duration of these 8-week course. So you are going to develop this each week. You'll be working with them in some way, developing the CAP for that week and working towards the final CAP project. So the second thing you do once you identify your subject is you perform this health history assessment on your volunteer using the attached part Q from up here at the top. Then perform a movement screen using the functional movement screen here. Let me roll this up here a little bit. Using the functional movement screen and create a table within Microsoft Word to actually record your assessment of your results of your subject. And this must be included in your write-up. Now here's a nice link on YouTube. I think it's about 21 minutes of a physical therapy clinic that will demonstrate how to actually perform the actual functional movement screen. But again, for reading purposes, you can go right up here and take a look at what's posted here on scoring criteria and Cook in part 1 and part 2. Here are materials that you'll probably need to help yourself assist in performing that. And actually, there's even a nifty video link here in where you can actually find out if you want to go a cheap, low-cost way to make your own functional movement screen. So you're gonna put together a typed report, 2 to 3 pages, double-spaced. Explain your client's results in detail. Describe any risk factors that you learned by doing the health screening, potential injury risk, or reservations you have about their ability to safely participate in the program. In a concluding paragraph, discuss the following things. What were your thoughts of use of the FMS? Would you use this screen to assess clients? Would you use a different screen or method, and why? And how comfortable do you feel with your ability to determine the root of your client's deficiencies on the FMS? Because normally if we see a movement problem, there's usually a soft tissue imbalance, or there's a reason people are compensating. At the end of your paper, include a YouTube URL of yourself performing the FMS. So you're going to actually video yourself actually assessing them. So make sure your camera's in landscape mode, and make sure your client has fitness of clothing on, and that you can be seen and they can be seen at all times during the actual, and you're speaking up. It can be picked up. Have them introduce themselves. Just follow the guidelines here. Use proper anatomical terminology throughout the time you're doing this. Make it professional, but have fun with it. And in your video, show the appropriate angles for each movement that you allow, and adjust the client or the camera to make sure you can get in. Here they are, the actual assessments here. So load it in YouTube. Make sure that it's set to public or unlisted, not private. Make sure it's public or unlisted. And keep the video to about 10 minutes or less. And if you want to look at it, here's the CAP 1 rubric that I will use for grading. It's been provided. So you're going to get the results. You're going to make a report. You're going to submit that, but you're also going to submit your YouTube URL link on that actual report. Okay. The final thing that you're doing is an exercise technique workout. This is a worksheet. I believe there's actually 5 questions on this. You'll see, and you actually have 3 attempts. So if you miss something, look at attempt 1 or 2 to make your best score. Okay, so your next thing to do is to actually look at the lecture videos that are provided. Once you've done that and taken your quiz, then proceed to work on these other things. The CAP assignment that's provided here, as we talked about, the health assessment and movement analysis, and then also work on the exercise technique worksheet. Please reach out to me. This is week 1. I want to get to know you guys. Reach out to me if you have questions. A few of you have already done so. Part of being successful online is being able to actually move forward, not get bogged down. And I just want to make this the best course possible I can for you. being a professional in the field. Okay? Blessings, everybody. Take care now.